Okay, so it's been 1 week now after my acromegaly surgery, pituitary tumor surgery, and back at home, been able to basically take care of myself, continuing to get stronger every day, and so this is basically a full 7 days later, and I think it's pretty amazing to be able to get brain surgery and be back home in 7 days. I'm not, at full strength yet, of course, but I do feel myself continuing to strengthen and get stronger, and I can at least do the basics to just, take care of myself here at home for now while I continue recovery. Can do, just the basics and kind of, maybe do a short walk, maybe now maybe 20 minutes or something, just to kind of try and continue to get a little stronger and whatnot. Do a lot of resting, a lot of trying to relax, trying not to overdo it because, at some point you feel real strong and then you feel like, you need to rest. I will say being at home without being able to use the CPAP is a bit of a task. Doctor says maybe after about a month I can start getting back on the CPAP again, and they won't let me use any, or they won't give me any oxygen to use at home. So I'm just basically having to endure some of the sleep apnea a little bit. I don't feel it's as bad as it was, my sleep apnea was in the past. I mean, I definitely feel it, but it's not like it used to be when I didn't use CPAP therapy. But I will definitely be welcoming the CPAP back once I can use it again, once things are healed in the nostrils enough to use it again. I wanted to mention for those of you, if you go through the surgery, if you're a diabetic and you've noticed that steroids raise your blood sugar, they're probably going to give you some steroids during your time in the hospital to help you start your recovery. So you probably have to do some additional blood sugar management and have to work with your doctors on that. Everybody's, different as far as that's concerned and how you'll come out in that respect. But that's something that you'll have to manage, and once you get home, have to make sure that you manage properly. And you should be able to, over time, be able to manage that with no issues or with minimal issues. Didn't really have much more to say. I think things for me are at that point where, where you've had your surgery, or maybe you've had if you haven't had surgery before, maybe you've had an injury before of some type. And, you at first you realize that you're really hurt, and then you kind of, after the recovery begins, you get to that point where you feel like, okay, I'm going to be all right. It's just going to take some more time, but I'm moving along. And that's where I'm at now. I'm at that point where I'm like, okay, I see myself continuing to strengthen. Going to be okay. Just takes time. But I don't see any major issues from this point. I thank God for that. And so for anyone that has to go through this, I'll say, just keep the Lord first. Have a lot of people praying for you. This is, although the medical science makes it a lot easier than it may have been 30, 40 years ago, this is still brain surgery, which is no joke. I definitely, by all means, recommend, as others have recommended in videos that I've seen, get the best surgeon you can get. I don't care if he's booked out the door, or she's booked out the door, or they're booked out the door. Get the best surgeon you can get to do your surgery. I made sure that I got the best one that I could get in my area. I highly recommend the same. You will have better success, more likely better success, if you get the best one you can. And sadly I had to turn down a doctor. I had to look him in the eye and say, no offense, but I really want a more experienced colleague that is your most experienced colleague. I don't want to work with you, although I think you're a fine person and probably a fine surgeon. Don't be afraid to, just say no if the person who wants to go into your head is not the most experienced person of all in your area for going into your head. I mean that. So I'm just thanking God this went so well. And so I'm just going to continue on in my recovery, and I hope that this helps you all. Anybody with questions, you can always ask questions. Depending on the type of question, I'm not going to promise you that I'm going to answer every question. Some people just ask things that are sometimes too personal, sometimes go too far, you know. So I'm not going to promise you I'll answer every question, but you're free to ask your questions. But have a nice day.